Hi everybody, and welcome to another episode of For the Health of It. I'm Dr. James Morgan, author of 101 Things Every Person in Healthcare Should Know. But today I'm going to be talking about something I think everyone should know, and that's the flu shot or the flu vaccine. So first, let me get right into it. What is the flu? The flu is a respiratory virus. It's not a GI issue and a gastrointestinal problem that a lot of people think it is, but it's a respiratory virus. Quick side note, virus means no antibiotics. Antibiotics do not work for viruses, folks. Hopefully you know that by now. But a respiratory virus, so it causes things like cough, congestion, runny nose, sneezing, fever, chills, fatigue, body aches, things like that. So what does the flu shot do? What does the vaccine do? Well, it causes antibodies, and antibodies are the cells that will go into the body and look to identify the bad guys being the antigens. So the vaccine causes antibodies to develop over about a 2-week period that research has shown to be the most common strains of the virus that are going to be out that year. So there's multiple strains each year. And what happened with the H1N1? A lot of times they get that. What happened with the swine flu? Well, the reason why they came out with another shot for the swine flu is because it was a strain that popped up out of nowhere. So what they did is they came up with another vaccine to make sure it's covered. Now strains like that are already covered in the flu shots for today. So now, who should get vaccinated? The very young, and that's usually around 6 months old. The very old, that's because usually those that are in the elderly population will have a weaker immune system. And of course, those that are working around people that are more likely to be exposed to the flu, such as healthcare providers. Let me tell you what the vaccine is not. The vaccine is not something that says you will for 100% sure not get the flu. Let's say this, if you don't get the vaccine and you do get the flu, a lot of times you'll be out on the shelf for a week to a couple of weeks. Whereas if you get the flu shot, it helps lessen the symptoms. It doesn't make the symptoms as bad, meaning you're only you'll bounce back a lot sooner than you would have without it. But let me tell you some of the complications of the flu. A lot of times, especially if you're healthy, you're able to fight things off pretty quick. But this is talking to those that have the immune system compromised, or if they're pretty young, without a strong, healthy immune system. It can actually be pretty deadly. The flu can exacerbate those that have a compromised immune system, can contribute to things like pneumonia, ear and sinus infections, especially in children, can even worsen long-term conditions such as congestive heart failure, asthma, and diabetes. So now let me tell you about the 2 ways to get the vaccine. One, you can get the live or the attenuated vaccine, and that's usually the nasal spray that's now pretty popular, especially among kids because they don't get a shot. So a quick nasal spray, you usually will give that between 2 to 49 years old. Things you have to be a very healthy person, very strong immune system, but make sure you talk to your healthcare provider to see if you would be a good candidate for that. Or you can get the inactivated flu vaccine, which is the shot. You also have a personal responsibility to take care of yourself. Don't go to work, don't go to school sick. Do what you can to take care of yourself so you're not going around and spreading the wealth, per se, of getting other people sick. So make sure that you remember you have a personal responsibility for that. As well, you also have a personal responsibility to understand the source of your healthcare knowledge. Where are you getting your healthcare information? If you're the type of person that's getting your health information from celebrities like Jenny McCarthy, then you might as well have your house built by your dentist, get your tires rotated and your car fixed by your doctor. It doesn't make any sense. Go to the person that specializes in your healthcare. Talk to them. Talk to your medical provider. Get the pros and the cons. Talk to them about your concerns. And that way we as a healthcare community can help give you the information that you need based around your specific individualized medical needs to make an informed decision. And at the end of the day, if it means that maybe getting the flu shot isn't for you because of maybe other healthcare reasons, okay. But get your information from a knowledgeable source, a reliable source. Getting your information from celebrities that aren't healthcare related or that didn't go to medical school or didn't go to nursing school, probably not the person you should be talking to about your healthcare needs. So ladies and gentlemen, that's it for today for The Health of It. I'm Dr. James Morgan. See you next time.